Yes, madam has connected. Okay, Dr. Archana.
My slides are visible?
Yes, yes, yes. It is visible now.
Okay. So I don't know from I was continue, but which slides I was reading? That I think this slide was displayed.
Yeah, yeah. This slide. Yes, yes.
Okay, okay. So we were discussing about the different roles of plants, and now what are there are two terms: phytopharmacology and natural products. Natural products are different, and phyto. If we are saying phytopharmacology, that is only for the sources from the plant sources. And when we are saying the natural products, it means it may be from plants resources, maybe animal resources, microbial resources, and it may be mineral resources also. Like antibiotics, if we are saying, so they are from the microbial resources. Shilajit, you might heard, that is from the mineral resources. So these, or if we are studying about all these are called natural products. But if we are saying about the phytopharmacology, that is only from the plant sources. If we will say what are the benefits or advantages of natural products as future therapeutics, so you know that if we are synthesizing a particular compound, so we cannot assume that which structure is having the that pharmacological effect or the biological activity. But in case of plants or the natural sources, there are immense structural diversity. If we will see the structure of Taxol, we will see the structure of that morphine. So we are having very, that diversity in the structure of these compounds. So we can say that we are having a wide variety of these structures or the compounds in the present in the nature. Then, comparative to the synthesized compounds, we are having these natural products are having comparatively fewer or less side effects. But we cannot say that they are not having the side effects, because we also know that the many plants are there which are toxic in nature also. And when we are using the plants in the form of that polyherbal formulation, or in the form of crude extract, or in the form of powder, in that case there may be chances of less side effects. Reason is that the compounds are present in comparatively less amount. But if we are using the isolated compounds, the toxicity will be more, because this is the single chemical compound. Or that if we are using it is in more amount, that may be the same that side effect as with the synthetic compounds. Then sometimes if we are validating the traditionally used medicinal plants, then there are less chances of toxicity, because already we are using these plants from centuries, so that we already know that these plants are not harmful. So in that case, if we are using validating the plants which are originated from Ayurveda, ethnopharmacological usage, or the traditional usage of plants, so they are basically, this is called reverse pharmacology. We are going from the clinical trials to the animals. So that is called reverse pharmacology. In that case, there are more chances of promising candidates for further study. And another important thing in which the in new drug discovery process we are using natural products. Generally, we are using natural products as a templates that I already discussed or lead compounds for the development of new semi-synthetic and synthetic drugs. Sometimes it's not necessary that in future we are isolating the plants that compounds from the plants. Always it is not necessary that we are obtaining from the plants. Hello, hello.
Yes, ma'am.
Uh, my slide is displaying.
No, no, it's not.
It's showing some problems in my computer also. Just a wait.
I think she is facing some problem.
Sir, is it visible?
Yes, yes.
There is some problem, I don't know, but suddenly it disappears from my laptop. So before it is, we have to go fast. So one thing that is important in case of the advantages of natural products, that one thing is it is accessible and affordable also. And one important thing is that uh, many natural products modulate multiple biological pathways. This is very important. multiple biological pathways simultaneously, which is especially important for treating complex multifactorial diseases, which where one target, one drug strategies may be less effective. So, in that such type of natural compounds are helpful in that case of that type of diseases. Uh, but there are some drawbacks also, which restrict the drug development process from natural products. That plants habitat, that if we will discuss about some plants like Taxol, which is anti-cancer drug, but its habitat is that it is grown only in the high altitude regions, like in India, it is grown in high altitude Himalayan regions also. We can't cultivate in the other fields. So sometimes we are specific about the habitat of a plant or its habit, and it takes many years to grow into a tree. So it's not easy to fulfill the requirement of the pharmaceutical industry as a raw material. So that is one of the drawback of that. Second thing, proper cultivation of medicinal plants. If there are many factors which are affecting the amount of the secondary metabolites, it may be the type of soil, the altitude, and the rain, and the different seasons which are affecting the constituents presence or amount in a particular drug. Then that environmental challenges are also because of that there may be the variation in the phytoconstituents. So that is, that these are the some factors which restrict the drug development process from the natural products. But we can work on these plants so that we can at least find the structure of compounds and used as lead molecules, so that in future if there is a limited source of supply, so these molecules or these structures can be used as a lead molecule, so that we can synthesize the same compounds within the lab. Now, in case of ethnopharmacology, then there are some problems like reliability of information, from which tribal community we are getting the information, biological variation in the plants, like some plant is going into the plain area or in the high altitude region, there is a variation in their compounds. And sometimes there is loss of species because of exploitation of the plant. Suppose berberis is an example. So berberis, its root part is containing the berberin. So exploitation, or if we are not harvesting in a proper manner, so after some time there is loss of that particular species, so that there is not a proper supply of the crude drug. So that is another drawback. And sometimes because of traditional knowledge is sometimes there is loss of knowledge, because they are not sharing their information to the unknown people or to the other persons. So that is another drawback of ethnopharmacological knowledge loss. And sometimes IPR issues, because sometimes we cannot file a patent for the traditional knowledge. So these because of that, many industries are not working on the traditionally used medicinal plants, because they cannot file a patent on these their research. So we have already discussed the various stages of drug discovery process, like plant collection, authentication, then further extraction of phytoconstituents, after extraction, fractionation, and isolation of compounds. Then the bioassay of extracts, fractions, and the isolated compounds. Then this is showing the fifth stage is structural characterization and lead optimization. These lead molecules, we are not saying that these are the drug molecules. Here we are saying that these are the lead molecules. Further, we can produce the potent or efficacious compound from these leads. That we have, one important thing that, that in sometimes before the extraction we need other processes, like we need to add some additives or treatment of raw material, like roasting, soaking in water, or storage for some time. So what is the this reason behind this? Suppose some of the drugs has to be roasted, because it is degrading the harmful type of enzymes during the roasting, so that these enzymes are not present in the final drug. And soaking in water, sometimes it is causing the hydrolysis of the some glycosides, because and reducing the toxicity of the compounds. And storage, you know that vanilla flavor, if flavor is more if we are keeping the drug for more duration. During that process, the enzymatic activity is taking place, and the more amount of the the active constituents are produced. So these treatments are also required. So if we are not considering these, the less amount of the phytoconstituents will be present in our extract. And one important thing that we to discuss here, in case of Artemisia enva, we know that artemisinin is present, which is very potent anti-malarial drug, and we know that it is having very low solubility in water. So, Chinese people were using water extract of this plant. They were just soaking the drug into the water and consume in next morning. They were used to consume the that water extract. But later on, when artemisinin was isolated, it was found that it is having very low solubility in water. So how it was present in that extract? Later it was found that the saponins which were present in the crude drug were also solubilized into the aqueous extract, and these saponins are increasing the solubility of artemisinin in water. So this is one of the example that mm, why the extracts or the crude extracts are sometimes more useful or having different activity than the pure isolated compound, because here the saponins are itself not having activity, but they are increasing the solubility of that artemisinin in water. So that is another example of extraction process. So I can skip this slide. I want to discuss this. Uh, So that is the flow chart of phytopharmacological, yeah, ethnopharmacological research, that we are getting information from the tribal communities. Then we are identifying the plant, and then we are that bioassay of that particular plant, which is called validation of the activity of the traditionally used plants. Then isolation and structural determination. I want to discuss about some examples, right? So. Some examples of natural products based drug discoveries, that these are very interesting examples. Now one of the example is this is the structure photo of salix alba. In North America, native people of North America chewed willow bark of this plant in case of headache. It means they were using it as an analgesic. So later on, willow bark is one of the source of salicylic acid. Actually, salicin was present. That yes, that if we will see that salicin is a compound which was later obtained from the bark of this willow plant. And salicin later on it and they were using it for rheumatism, in the pain in case of rheumatism. Later on it was found that salicin, if you will see the structure of salicin, this is a glycoside having a salicyl alcohol part, a salicyl alcohol and a glucose molecule. So on hydrolysis, it forms salicyl alcohol and glucose molecule. This salicyl alcohol on oxidation produces salicylic acid. So for most of the later on, this salicylic acid was used as analgesic in many countries. It was developed for large scale production as analgesic, but it was found that salicylic acid has shown gastric irritation and bleeding at higher doses. So because of this side effects of salicylic acid, it later on in 1897 it was acetylated and to form acetyl salicylic acid. So acetyl salicylic acid is aspirin. We know that how that important analgesic is aspirin. Later on, Bayer company commercialized aspirin in 1899. So we can see that this is salicylene, which was used by the native people of North America by chewing the willow bark. It is was containing salicylene. From that, the salicyl alcohol was produced, and on oxidation, salicylic acid was produced, and it was for a longer time was used as an analgesic. After acetylation, it reduces the side effects of salicylic acid, and this acetyl, here is acetyl group by replacing the hydrogen from this is the acetyl group which is present. And nowadays we know that the what is the use of aspirin. So we here what I want to say that this aspirin was originated from the traditional use of the people of North America. Now we also know that another important plant, quinine, yeah, plant constituent, we can say that quinine. Uh, there was malaria was very common in 17th century or later on, and the indigenous people of South America were using the bark of cinchona tree, Cinchona officinale. There are many other species of cinchona also. So the indigenous people of South America were using the bark of cinchona tree uh, to reduce the fever, which is basically produced by the Plasmodium parasite, and later on quinine, which is a quinoline alkaloid, was obtained or isolated from this cinchona bark, and we know that it was for a very long period. It was used as anti-malarial medication for centuries, and later on, that isolation was of quinine was done in 1820, and pure isolated quinine rather than the bark powder, pure isolated quinine was used as a drug for malaria. Now, this is the structure of quinine. This is the quinoline alkaloid, and quinidine was later also isolated from that, but quinidine was later found as being anti-arrhythmic activity. And but we know that quinine or these type of compounds which are used against they got resistant. So because of that, the synthetic derivative was obtained, which is called chloroquine. But again, you can see that having the same moiety, this quinoline moiety is also present in the chloroquine. There is a difference in the side chain, and the idea also obtained from the quinine for the synthesis of chloroquine, which was later used as synthetic derivative, synthetic antimalarial drug in the market. Now, another very important that everyone knows about the metformin or the use of metformin nowadays in case of diabetes. This is very important drug as anti-diabetic drug to treat type 2 diabetes, and its origin not directly but its origin also hidden from the phytopharmacological research. There is a plant Gallica officinalis, and this was used in Spain to treat conditions of thirst and frequent urination. We know that these are the conditions of side effects or the symptoms in case of type 2 diabetes, where there is excessive thirst and frequent urination. So that the local people were using to reduce these symptoms. So later on, in 18th century in Europe, it was used to reduce these symptoms. And basically, this is a galactagogue in case of animals to increase the milk secretion. And chemically, it was found that that a guanidine guanidine compound was isolated from this. The above one structure is the guanidine. Guanidine was isolated from this Gallica plant, and we already know that it has shown the symptoms of diabetes. And metformin is not isolated or not present in this Gallica plant, but the idea that this guanidine is having the relief in diabetes, so it's biguanide. If you will see, you can see that there are two guanidine moieties are there. This so metformin is a biguanide derivative, and the idea came from the guanidine. So metformin Later on, it was isolated. Hello.
Okay, you can continue.
Okay. So, metformin idea came from this guanidine from Gallica plant. And another important plant that everybody knows is called Sadabahar. Sadabahar, we know that Sadabahar, which is also called Vinca rosea or Catharanthus roseus. Its important story is that it is called Madagascar periwinkle, and traditionally its leaves were used by the local people to relieve the diabetes. They prepare tea or decoctions of the leaves to relieve the symptoms of diabetes. So later on, during a study or search by Robert Noble, he found that the leaves are showing comparatively less anti-diabetic potential, but what he noticed that this plant is having cytotoxic activity. So from the idea of the cytotoxic activity, he found that it is reducing the bone marrow and white blood cells count. So actually he was checking the anti-diabetic potential, but it was found that it is having cytotoxic activity. And later on he isolated a very important compound, vinblastine. Vincristine and vinblastine, both compounds were isolated, and vinblastine, this is the structure of vinblastine, and it was very promising anti-cancer compound. Uh, then it is used in case of leukemia, childhood leukemia basically. So, and this is in the modern system of medicine as anti-cancer drug. Now we can say that this is originated from the phytopharmacological research from the traditionally used medicinal plants, which was basically used as anti-diabetic. So this is, and how we can see that how complicated the structure of vinblastine is this. So this is in the as anti-cancer drug. One another important anti-cancer drug is Texas brevifolia. We know that Taxol is which is also called paclitaxel. It was obtained from this Pacific yew tree, which is called Texas brevifolia, and this bark is basically the source of Taxol. Taxol, why it is called Taxol? It is obtained from the Texas plant and having the hydroxyl groups or alcohol, so that's why it is called Taxol. And another important thing that it is not commonly found. It is found in the temperate region or the very cold region. Here it is also in some parts of the Uttarakhand also, but in a certain in a particular region. So it's not possible to cultivate this plant all over or any other place. So we can say that this, and another thing, that it is not obtained from the leaf, it is obtained from the bark. If we are removing the bark of the plant, the tree dries. So that's why this is the limited supply of these plants is there, or limited supply of these phytoconstituents. Another important thing is that Taxol is present in 0.0006% only. So that is another drawback, that as these plant as a renewable source of these. But in that case, if we know the structure of this compound, again we can say that it is a complicated structure, and it is used FDA approved drug for ovarian cancer and other forms of cancer it is used. So how we can find out in sufficient amount so that it can be prescribed to the cancer patients? First thing, it is not cultivated. It is not possible to cultivate everywhere. Second thing, bark is obtained because and it dies the plant, and it's a tree, it's not a bush. It takes many years to grow into a tree. So if we will remove the bark, the plant dies. So we are not having a continuous supply of that. Because of that, later on, its needles, you can see that its leaves are the needle shaped leaves. So its leaves are containing some other compounds which are called baccatin. That is mm, uh, 10-deacetyl baccatin third. So these are extracted from the needles, because needles, it is not causing the death of the tree, and these compounds can be synthesized or changed into the Taxol. So that is another approach, so that we can obtain in a definite amount, so that it can be prescribed to the cancer patients. So that is another approach. And a third approach is that we can synthesize in the labs also. One important drug is artemisinin, which is obtained from Artemisia annua. Earlier, we studied that quinine obtained from the cinchona bark, but we know that after some time, the malaria parasite becomes resistant to a particular type of chemotherapeutic agent. So there is always search of new phytochemicals or new compounds which is having anti-malarial property. And there is different types of anti-malaria also, that like falciparum malaria is also there. So because of that, a research group in China was working on some to find out the anti-malaria drugs from the natural sources. So in China, they were using the leaves of Artemisia annua. It's extract basically they were using for to reduce the symptoms of malaria. So later on, they found a sesquiterpene lactone from this, which is called, this is the structure of artemisinin. So this artemisinin was isolated from Artemisia annua, and later on, it was used as a lead molecule and many other derivatives. I told you that artemisinin is having a solubility problem. It is less soluble in water.
Excuse me, madam.
Yes, sir.
Excuse me, madam. The screen is not changed, I suppose.
It's not changing.
Yeah, it's displaying Taxol.
No, no,
Oh.
change it, change it.
But in now,
Yeah,
Now
it is
it's changed.
changing.
Yeah, now
okay,
it has
okay,
displayed. Okay.
okay. So this is the artemisinin, about artemisinin I am telling you. So artemisinin is that is we can say that it is used in case of falciparum malaria or cerebral malaria. And a Chinese scientist got a Nobel Prize for this. That Tu Yu in 2015, she got a Nobel Prize in medicine. And because of the solubility problem of artemisinin, or to increase the efficacy of artemisinin, it was used as a lead molecule, and other many derivatives were produced from artemisinin. One of the important derivative with increased efficacy is artemether. Here the difference is that there is a methyl group here. This is ether. So artemether is more efficacious. Second thing, if there is a solubility problem, so sodium salt of artesunate, here if it is sodium ion, so sodium salt of artesunate, if we, this compound is more efficacious and increases the solubility of artemisinin in water also. So these are the derivatives, and this is also indicating that here the phytoconstituent is used as a lead molecule to produce more efficacious and that more efficacious compounds or the derivatives. So these are the some examples, important examples of compounds. There are many more other compounds also. For example, podophyllitoxin is also there, which is obtained from the Himalayan mayapple, Podophyllum hexandrum. And this podophyllitoxins like etoposide and teniposide derivatives, they are also having anti-cancer property. So we can say that again, the plants or the natural products are always a source of or new discovery, or to find out the new compounds uh, for different type to uh, treat different diseases also. So phytopharmacological research is always going on, and there are some other examples also. We can say modern examples of drug discovery based on the ethnopharmacological approach. This is based on the ethnopharmacological approach. But sometimes we are going into the clinical trial phases, but later on there is need to withdraw the compounds. For example, prostatin is a compound. It was traditionally used in some part of then uh, isolated. This prostatin compound was isolated from Homalanthus nutus, and it was having anti-HIV drug in initial studies, but later on it was dropped because of the toxicity effects of that particular drug. So this was withdrawn. Initially it has shown good activity, but later on withdrawn because of toxicity. One more compound is there, which is called flavopiridol. Flavopiridol was obtained from the bark of Indian tree, and it is traditionally used for arthritis. Arthritis means it is having the anti-inflammatory property. But during its anti-inflammatory property in lab animals, it inhibited tyrosine kinase. So, if since inhibition of kinase activity may decrease the tumor growth, so it was found that it may have the anti-cancer property. So, it was in advanced stage of clinical testing, and recently we have searched that now it is a marketed drug. Recently, we have found that this is a marketed drug which is called as flavopiridol from the bark of Indian tree. One important another compound is heparin A. Heparin A, which is obtained from Hypericea serrata. This is a club moss. This is not that flowering plant. This is a moss, and traditionally used to drink by elderly people in China. So they were using the drink or tea type of drink. Elderly people means later on it was found that heparin A is an alkaloid which is having choline esterase inhibitory activity. If it is having a choline esterase inhibitory activity, means it may increase the level of acetylcholine, which is generally decreased in elderly people, or one of the symptom that one of the cause of Alzheimer's also. So memory loss problem is there also. So if in clinical use, this heparin is now in clinical use in China and under clinical trials in other countries also, and it is recently we have checked it is marketed in many countries uh, to increase, we can say that in case of Alzheimer's like symptoms, because it is increasing the level of acetylcholine. Thus, galanthamine nowadays, galanthamine is containing, galanthamine is obtained from Galanthus, different species of Galanthus. This is also a traditionally used plant in some part of the world. And this galanthamine is also having choline esterase inhibitory activity. Because of that, it is useful in case of symptoms of early stage Alzheimer's disease because of increasing the level of acetylcholine. So this is galanthamine is also very important. Now, at last, I want to show you some important, which is called basically called the world's worst diet. Here, a tribal community in Africa is used to take the camel milk by adding camel blood. You can see in a picture also. He is adding camel blood into the camel's milk. So this is called the worst diet of the world. Why it is called worst diet? You know that that blood is also rich of many constituents, and milk is also containing many rich constituents. So if it is supposed that if a person is taking such type of diet, it may have the high level of cholesterol. But in studies, it is found that these tribals are generally having lowest blood glucose cholesterol levels of any group on earth in studies. So what is the basis if they are taking such type of diet, why their cholesterol level is not increasing? So later on it was found that the members of this tribal community know they are having knowledge about a plant bark which they are adding in this mixture, and later on it was found that this bark is having hypolipidemic activity. So because of that bark, their cholesterol level is not increasing even after taking this diet, a rich diet of blood and milk. So this is, I think, all about my presentation on today's topic. So finally, we can conclude that the natural products and their derivatives have historically been invaluable source of therapeutic agents, and in future also this is a good source of compounds which may have in future also many compounds may be originated from the plant sources. And there are some drawbacks also, some problems we have that in phytopharmacology also, but still we can see plants as a rich source or a renewable source of phytoconstituents to fight against different diseases, maybe anti-cancer, maybe anti-diabetic, to manage the diabetes. Many we are using many plants to manage the diabetes. So always there is we can say that plant research is always, or in future also, we might have some good compounds from the natural sources. So this is all about my presentation. Thank you so much. If someone is having any query, so so Dr. Aman is there?
Yeah. I'm here.
Okay, this is
It
all
was,
about from my side.
okay.
Yes,
So, dear
participants,
audience,
if
uh,
you have queries, you can ask. Madam is
Yeah,
there.
if you have any query, or I would try to answer your query.
Yeah. Okay. Thank you very much, ma'am, for such a comprehensive and inspiring session. Your lecture beautifully highlighted the scientific potential of natural products and their relevance in the modern pharmacological research, especially the way you explain the selection of the plants for pharmacological research, the um, journey of some phytochemicals to the clinically useful drugs is really admirable. On behalf of SNJB Sriman Suryadas College of Pharmacy, it gives me a great pleasure to present the virtual certificate of appreciation to Dr. Archana ma'am as a mark of our sincere gratitude for sharing her valuable insights and expertise with us today. Ma'am, kindly
Thank you so
accept.
much.
Yeah.
Thank you so much for giving me this opportunity to interact with your students also. Thank you so much, sir.
Thank you
thank
once
you,
again, ma'am.
Archana. Okay, thank you.
Thank you, sir.
Thank you once again, ma'am, for accepting our invitation and significantly contributing to the academic success of this faculty development and student development program. Thank you once again. I
Thank you so
kindly
much.
request all the participants to ensure that they have completed the attendance feedback form shared in the chat box. Tomorrow is the day 4 of this FDP SDP. We will focus on advances in experimental and molecular pharmacology, where we will explore the integration of computational tools and in silico approaches in pharmacological research. We look forward to your continued participation. With this, and with the permission, I conclude today's session. Thank you all for your time, attention, and keen involvement, even on Sunday. Have a pleasant and productive evening ahead. Thank you, Anna.
Okay.
पावसाचं इलेक्ट्रॉनिक टीव्हीचं सांगते का? हो ना.